Hello everyone, I'm Allison. We're going to talk about levodopa carbidopa medication today. The brand name is sinemet. So what is levodopa and carbidopa and what is this for? This medication is anti-Parkinson drug and dopamine synthesis medication. Parkinson's disease occurs when dopamine producing neurons progressively degenerate, leading to decreased dopamine levels in the brain. This dopamine deficiency causes symptoms such as tremor, rigidity, bradykinesia, and posture instability. Levodopa is dopamine precursor. Once inside of the brain, levodopa is converted into dopamine, helping restore dopamine activities and improve motor symptoms in patients with Parkinson's disease. Carbidopa is combined with levodopa to prevent the peripheral breakdown of levodopa before it reaches the brain. Carbidopa allows more levodopa to reach the central nervous system. Common adverse effect of levodopa carbidopa is nausea and vomiting, confusion, anxiety, insomnia, orthostatic hypotension, hallucination, dyskinesia, which is involuntary movement caused by rapid dopamine increasing. So now we are worried about the fall risk because Parkinson's disease itself increases the fall risk, and taking levodopa carbidopa can add involuntary movement and orthostatic hypotension as a side effect. So when we picture the patients taking this medication, they might say they cannot sleep, but they can hear or they can see something and confused. They also feel dizzy when they get up from the sitting or laying down and having more involuntary movement. I want to mention about something unique phenomenon with this medication. So first one is wearing off phenomenon. This occurs when the effect of levodopa carbidopa gradually becomes shorter over time. The medication works well at first, but before the next scheduled dose, dopamine level begin to drop and Parkinson's symptoms returned. Patients may notice tremors coming back, increased rigidity, slower movement before the next dose. So for example, the patients take this medication at 8 in the morning, feels good for a few hours, but by the time 11, the symptoms slowly returned before the next dose at noon. And other one is on-off phenomenon. This is a sudden and unpredictable change between mobility and immobility. So we called mobility mode as on period. This period medication is working so fine and patients can move normally, but off period medication suddenly stops working. Patients may freeze or become rigid. Unlike wearing off, this can happen suddenly without warning and is not always related to medication timing. Levodopa carbidopa is contraindicated in patients with a narrow angle glaucoma because it can increase intraocular pressure, which may worsen the condition and lead to vision damage. Levodopa carbidopa should not be used with non-selective NaOIs because the combination can cause a hypertension crisis. MAOI should usually be discontinued at least 2 weeks before starting levodopa carbidopa therapy. Patients' education. You can instruct the patients take this medication exactly as prescribed and do not stop it abruptly. because sudden withdrawal may worsen Parkinson's symptoms or cause serious complications. Remember, this medication is time sensitive. Avoid taking the medication with high protein meals because protein can interfere with levodopa absorption and decrease the medication's effectiveness. It may be better to take the medication 30 minutes before meals or 1 hour after meals because levodopa carbidopa can be absorbed better on empty stomach. Change position slowly when getting up from sitting or lying down to help prevent dizziness and falls caused by orthostatic hypotension. Dark-colored urine, sweat, or saliva may occur while taking this medication. This is usually harmless but can stain clothing. Report hallucination, paranoia, confusion, nightmares, or unusual behavior changes to healthcare provider. In some cases, medications such as clozapine may be prescribed to help manage these symptoms. The medication may take several weeks to reach full effectiveness, so it is important to let patients know that continue this medication even if there is no improvement at first place. Notify the provider if a patient's client involuntary movement is worsening, such as twitching, facial grimacing, or jerking motions, as these may indicate the dyskinesia from excessive dopamine effects. Tell the patients that avoid driving or operating heavy machinery until the patients know how this medication affects them. Levodopa carbidopa summary. This medication is for Parkinson's disease. It helps involuntary movement to stable. Levodopa is a precursor of dopamine, and carbidopa helps levodopa to cross the blood-brain barrier. Think like carbidopa is a nice car, and this nice car can move levodopa safely. I want to know about some side effects. First one is dyskinesia, which is involuntary movement caused by too much dopamine in the brain. The provider may adjust dose. Orthostatic hypotension is a big one, which is directly related to fall risk, patient's safety. Patients with this medication may experience insomnia or hallucination. Report provider if they have these symptoms. The provider can prescribe second-generation antipsychotic medications such as clozapine. Encourage patient this medication at regular intervals. This medication is time sensitive. Instruct the patients do not stop this medication abruptly, and it might take several weeks to see some improvement. Also, avoid high protein meals can interfere with levodopa absorption. The best timing is taking this medication 30 minutes before meals or 1 hour after meals, since the medication absorbs better on empty stomach. Okay, that's it. Thank you for listening.